Good evening, everyone. My paper is on a novel synthetic material to prevent Symblepharon in chemical injuries. Symblepharon is a pathological condition wherein bulbar and palpebral conjunctiva form an abnormal addition to one another. It occurs secondary to chemical injuries, drug reaction, SJS, and ocular surface procedures. It is easier to prevent than to treat. Many modalities are available to prevent Symblepharon, but the pathogenesis of wound healing of conjunctiva and tenons is unpredictable. Hence, the prevention of recurrence is still challenging. In the study, we aim to evaluate the clinical outcomes of Gore-Tex as an adjuvant in preventing the recurrence of Symblepharon in chemical injuries. It was a retrospective review of 11 eyes of 10 patients between 2011 and 2019 with a maximum follow-up of 12 months. All chronic cases of chemical injuries presenting with a moderate to severe Symblepharon with extraocular motility restriction were included. The procedure was performed under general anesthesia for patients under 20 years of age and peribulbar anesthesia for the rest of the patients. Symblepharon with moderate grade of involving the less than 180 degree of the ocular surface was treated with Symblepharon release with Gore-Tex amniotic membrane graft, living related conjunctival allograft or autograft. Patients with severe grade of Symblepharon involving more than 180 degree of the ocular surface underwent Symblepharon release with Gore-Tex amniotic membrane graft, and simple limbal epithelial cell transplant was done. Post-operatively, after 4th week, Gore-Tex was removed, and follow-up evaluation was done at 1 week, 2 weeks, 1 month, 3 months, and 6 months, and 4th monthly until 1 year. Post-operative treatment given was the antibiotic steroids for 2 months in tapering doses, oral steroids for 2 weeks, doxycycline and vitamin C for 2 weeks. Success was defined as an epithelial ocular surface without conjunctival or corneal recurrence of Symblepharon at 12 months. Partial success, epithelialization of ocular surface with mild conjunctival recurrence at 12 months, and persistent inflammation or severe recurrence of fornacial shortening was defined as failure. 11 eyes of 10 patients were included with a median age of 17 years and median follow-up of 36 months, and the median time interval between the onset of symptom and the first presentation was 9 months. We included 6 eyes of severe Symblepharon and 5 eyes with moderate Symblepharon with corresponding areas of limbal stem cell deficiency. Along with the Symblepharon release, Gore-Tex amniotic membrane graft and conjunctival allograft, 2 patients underwent living related conjunctival allograft, 3 patients conjunctival autograft, and 6 patients SLED. The mean duration of epithelialization was 5.27 weeks and mean duration of recurrence was 6.75. In all our patients, the best corrected visual acuity improved statistically significantly improved post-operatively, and the surgical outcomes include we had 54.5% of success rate and 36.3% of partial success, and one patient like 9% of having failure. Among the patients with moderate grade Symblepharon, all patients had success, and among patients with less than 180 degree, more than 180 degree, with severe cases, we had only 16% of the patients with success rate, and 66% partial success was observed with mild conjunctival recurrence. And complications, we did not have any sight-threatening complications, and we had 4 cases of pyogenic granuloma, and spontaneous extrusion of Gore-Tex was noted in 2 eyes before 4 weeks, and recurrence was noted in 4 eyes, and 2 eyes underwent repeat procedure. Fungal infection was noted in 1 eye, but the underlying ocular surface was free of infection. These are few cases in which the Gore-Tex and CLAG was done. Gore-Tex is left in place for 3 to 4 weeks of proliferative phase of conjunctival wound healing. So hence it reduces the exaggeration of fibroplasia and angiogenesis, and thereby prevents the recurrence. It acts as a spacer or the mechanical barrier, preventing the fibrous regrowth and adhesion of the adjacent tissues. Our patients had severe LSCD, with all were young patients, and they were associated with severe fibroblastic response. Amniotic membrane, it promoted epithelialization, and the conjunctival allografts and autografts and SLED helps in repopulating the stem cells. So our limitation were it was a retrospective analysis with a small sample size, and several surgical steps were involved in the procedure, like removal, dissection of the fibrous tissue from the ocular surface, and placing the Gore-Tex involves amniotic membrane it has to be sandwiched between the two amniotic surfaces. It can't be glued to the ocular surface. That was a disadvantage. It has to be sutured with the 10O nylon sutures to the ocular surface, and little longer surgical time was also required, and cosmetic concern was noted in few patients. And Gore-Tex, in concluding, it seems to be very safe in young children. It can be cut into different shapes, and it is easily available and effective in preventing the fibrovascular regrowth. It is more or less repeatable also, and there was no sight-threatening complications noted, and in future it can act as a novel surgical option to prevent the recurrence in various ocular surface disorders. In this case, total Symblepharon was managed with placing Gore-Tex superior and inferiorly with conjunctival allografts from the cadaver as well as from the fellow eye. Thank you.
Thank you, Dr. Anita.
Thank you.
My question would be, why did you embark on this study?
Sir, because there were so many patients we had with severe grade of Symblepharon, and there was a recurrence of the growth in every patient which we operated. So we thought we wanted to prevent the recurrence of this growth, fibrous growth, and most of them were young children. So, and with chemical, they come with very grade 4 alkali injuries. So we thought we'll do something for recurrence.
No, my question was a little different. My question was, we have other materials which have been well talked about in literature, silicone, etc. Why would you choose Gore-Tex, and what was the reason for doing this? Because were you looking at a cost benefit? Were you looking at a material benefit? What was the hypothesis behind this?
Yes, sir. Gore-Tex was like inert material, and it is biocompatible, sir, and it resisted infection, and the epithelialization was very good. Underlying the Gore-Tex, the epithelialization, that surface was very good, and the recurrence was very less, and fibrous tissue overgrowth over the Gore-Tex did not occur.
Did you compare it with the other materials?
That was not done, sir, maybe.
Okay.
Thank you.
Thank you.